Welcome to this explainer. Today, we're going to jump right in and break down the clinical profile and some absolutely vital safety warnings for a really unique, highly potent medication. We're talking about methotrexate. We are going to look directly at the clinical guidelines to understand exactly how it works in the body and, most importantly, how to stay safe when using it.
So let me hit you with the question that really gets to the heart of why this drug is so fascinating. What single medication out there is powerful enough to fight cancer, but precise enough to treat arthritis? I mean, it sounds like a paradox, right? How does one compound operate at such completely different extremes of medicine? Well, to get that, we have to understand the fundamental way it interacts with human biology. Meet methotrexate. This is a massive heavy hitter in the medical world, and it bridges a really unique gap. But because it's so potent, it requires a solid, comprehensive understanding to use it properly. To really wrap our heads around its clinical profile, we first need to know what overarching category it belongs to. It's known as an antimetabolite.
Now, don't let the medical jargon throw you off. An antimetabolite is basically just a class of drugs that runs interference on the normal metabolic processes happening inside our cells. And the main reason doctors use them? To deliberately slow down cell growth. So in conditions where cells are just multiplying way out of control, this is an absolute game changer. It literally hits the brakes on rampant cellular replication. Keep that idea, slowing down cell growth, in the back of your mind as we go forward.
Okay, so we know it's an antimetabolite, but let's talk about the mechanism of action. How exactly does it pull this off inside the body? Let's take a look under the microscopic hood. Think of this as a highly precise biological domino effect. It's basically a three-step process. Step 1, methotrexate steps in and inhibits a very specific enzyme called dihydrofolate reductase. Think of that enzyme as a crucial worker on a microscopic assembly line. When that worker gets blocked, we hit Step 2, a reduction in folic acid metabolism. And because of that sudden bottleneck with the folic acid, the final most critical domino falls in Step 3. It slows down the production of DNA. And you know, since every single new cell needs a fresh copy of DNA, halting that production means cell growth effectively grinds to a halt. All right, so we've got the cellular level down, interrupting the assembly line to slow DNA and stop growth. But what does that actually mean for the patient sitting in the doctor's office? Let's shift gears and look at the real-world conditions this medication is prescribed for. The applications here are incredibly diverse, and this is where that whole mechanism we just talked about totally makes sense. Remember that concept of slowing cell growth? That is exactly why methotrexate is used for conditions driven by overactive, rapidly dividing cells. We're talking about the rapid skin cell turnover in severe psoriasis, the aggressive cell division in certain cancers, and those hyperactive immune cells that drive inflammation in rheumatoid arthritis and other autoimmune diseases. It's a profoundly versatile tool for specialists, precisely because it targets that one root cause. But listen, as with pretty much everything in medicine, this level of power doesn't come for free. It's always a delicate balancing act between efficacy and toxicity. So we really need to take an honest look at the cost of this drug's potency, the side effects. Patients taking it might deal with nausea, vomiting, mouth ulcers, and fatigue. Why? Well, go back to how it works. Because the drug indiscriminately targets rapidly dividing cells, it doesn't just hit the bad ones, it also affects fast-growing healthy cells, like the ones lining your stomach and your mouth. And more seriously, it can cause liver toxicity and bone marrow suppression. Now, to translate that clinical term, bone marrow is another spot where constant, rapid cell division happens. When that gets suppressed, the drug lowers the production of new blood cells, which can lead to dangerously low red and white blood cell counts. Now, because of these systemic, whole-body impacts on healthy tissues, you really can't just take this medication and forget about it. It requires active, structured management, which brings us to our next crucial point for safe administration: vital organ monitoring. As the clinical guidelines explicitly mandate, methotrexate can be highly toxic to the liver and kidneys. Because of that, regular medical monitoring, usually through routine blood tests, is strictly required during the whole course of treatment. This isn't just some optional precaution. These frequent lab draws are specifically designed to watch out for silent liver and kidney toxicity, making sure your major organs are actively clearing the medication safely. Okay, I need everyone to pause right here. Literally stop what you're doing. This is the absolute climax of our explainer today. We have to talk about a life-saving safety warning regarding exactly how this drug is dosed, because attention to detail here is paramount.
Here is the critical takeaway. Methotrexate is usually taken once a week for conditions like rheumatoid arthritis. It is not taken daily. I mean, we're also conditioned by modern medicine to just pop a daily pill with breakfast, right? It's a deeply ingrained habit, but actually, scratch that, it's more than a bad habit here. Taking methotrexate daily by mistake can cause serious, potentially fatal toxicity. A simple calendar mistake with this drug can literally be a matter of life and death.
1. I want to draw absolute attention to this number, just to drive home the golden rule for common conditions like rheumatoid arthritis. The dose is just 1 time a week. Remembering this single fact, replacing that daily pill reflex with a strict weekly schedule, could quite literally save a life.
So given everything we've just covered, from its potent antimetabolite mechanism to the severe risks of liver toxicity and, of course, that fatal danger of incorrect dosing, it should be perfectly clear why this next point is non-negotiable. Methotrexate must only be used under the strict, direct supervision of a qualified healthcare professional.
And hey, in that exact same spirit of safety and clinical care, I do need to clearly state our formal disclaimer. This explainer is for educational purposes only. It doesn't, and frankly never will, replace professional medical advice, diagnosis, or treatment protocols from your actual doctor.
We've seen today how a foundational understanding of just one medication, methotrexate, can literally save lives. But it leaves us with a kind of provocative thought, doesn't it? How intimately do you know the safety protocols, dosing schedules, and potential side effects of all the other medications currently sitting in your cabinet? Knowledge is always your absolute best defense. Thanks for hanging out with me for this explainer. Stay curious, stay informed, and stay safe out there.